Hi, I'm Martha Riseberry. I'm a PGY2, and I picked Goderich as my home base for residency training. Primarily, it was my first choice because of the people. The team here is awesome. The attendings here are extremely experienced in all aspects of rural family medicine, emergency, anesthesia, inpatient care, and their approach to family medicine, to patient advocacy is second to none. And that's why I wanted to be here. People will ask sometimes what it's like to be in a program where there's only 2 or 3 residents. And yes, sometimes you can feel a bit separate from the rest of the program, but we're family and we look out for each other. We help each other studying in our patient care. If we have a difficult patient, any time when you feel like you might need a little extra help, you know that you can turn to your colleagues, be they the other resident or residents, or the attendings, the administrators, and the other staff that aren't officially part of the residency training team are always willing to help out the residents and assist in their learning as well. And I think that's awesome. I have tried to interact with other rural residents, which has been very helpful, very successful, and I've made friends with other people and have been able to learn from other groups of rural residents as well. And I do try to get to London when I can for teaching. I think it helps as well with the academic half days, but it's not necessary. And I'm really glad I chose the program that I'm in.
Hi, I'm Neill. I'm one of 2 preceptors at the Goderich site, where we have primarily 1 training spot at a time. So we have sometimes 2 residents, but most of the time 1 resident. And our program is highly experiential. That is our focus. It is split probably about 50-50 between hospital-based work and clinic-based work. And I think it represents a typical cross-section of a truly rural practice. We have 1 resident that we share between two doctors, and the result of that is that residents get the experience of having exposure to 2 doctors at slightly different age perspectives, and Dr. Pavu is an anesthetist in the general practice realm. I do work as a coroner. We both work in long-term care. We both work at the hospital and do work in the emergency department as well as the ICU and inpatient departments, as well as having clinics at the office. So I think what we are most proud of is the diversity of the practice that we make available to the residents, and we look to people to roll up their sleeves and get started and participate. We have in the practice itself a resident practice, so there's a group of folks who specifically see the residents and are comfortable with that process, and that practice has matured and occupies the residents, so they don't feel like they're seeing people that would really rather see somebody that they're more used to. The hospital practice features a lot of work in the emergency department. We know the residents really find that experientially very rich. And because there are 2 of us, there are twice as many of those opportunities. And in addition, we share our inpatient practices and our ICU practices. So there's lots of experience and lots of things happening.
I'm Dr. Sama Pavan. I'm one of the preceptors at the family practice teaching site in Goderich. And we teach residents here in family practice, both first year and second year. My duties in my community are as an emerge doc, as a family practitioner, in my office, as in providing inpatient coverage for my patients and orphan patients in the hospital, and also as a GP anesthetist providing anesthetics. The residents get to be involved in all those aspects if they choose. The core things that we want people to be ready with when they leave our place is be able to look after the patient in the family practice office, to look after them in the hospital, and also look after them in the community.
The second year is a longitudinal stream, and we found that that's been very strong for the residents. And by that we mean that the residents pick from a palette of specialists, rural specialists primarily, whom they can spend time with in an orthopedics clinic, an ophthalmology clinic, or doing some obstetrics gynecology. And we can accommodate people who are interested in obstetrics by spending some time with the obstetrical doctors who we work with. All in all, our feedback is that people like the opportunity to work in a large variety of areas and to experience rural practice straight up and to be in the same place for an extended period of time. Most of the residents find a spot they want to live in and they settle in, and many have families, and it seems to work out well. It's an enjoyable community to live in.
I think by coming here and doing their residency here, residents would be able to practice in a similar setting and be comfortable at the end of 2 years. So I think that's a big plus. I think it's also a very nice community to work and live in, and it's been a great place to raise my family. And there's lots of recreational opportunities and things to do to keep yourself busy and engaged.
Do you like to be on holiday? Do you like to live by the beach? Goderich is a resort town. Historically, it was one of those places that people traveled for miles and miles, and from the United States, and celebrities used to come here. And it's not as busy as that now, but it's still a resort town. If supper's finished and you've got a little extra time, then in the summertime you can just walk down to the beach. We live a couple of blocks from the steps down to the beach. There's the Maitland Valley trails, which are great if you like to bike or walk. You're close to a lot of other different places. Grand Bend is south of here, where there's the Pine Root Provincial Park, which has no mosquitoes and no black flies. And I know this, I've actually camped there and it's awesome. You're an hour from Stratford, which is a great place to go for off-service rotations and horizontal electives, as well as for dining and theatre and just a change of scenery. Kincardine has some great restaurants, and it has beaches as well, and you're close to a lot of other communities. And London is only an hour and a half away in good weather, and Toronto's not that far. So it's a great community. The people here are so friendly. And as far as small towns go, it's got a lot going for it. It has theaters, both live theater and movie theaters. It's got some restaurants that are really good, and Bayfield is close by. They have some awesome restaurants. There's good little small stores, and you don't really have to go very far to get very many things. And the people just can't do enough to welcome you to the town. When they hear why you're here, they're just so grateful. And it's just such a friendly community.